Hi, everyone. So today I am joined by Dr. Bobby Sura. Dr. Sura is a consultant clinical psychologist as well as a psychotherapist. And I have known and looked up to Dr. Sura for years, and listening to him or speaking to him has always put me at ease straight away. And that's because of, the great sense of calmness that he exudes. So very warm welcome, Dr. Sura, and thank you so much for sparing some time for me today.
Thanks, Jagjit. Lovely to be with you. Thanks for asking me to come on.
Great, thank you so much. Dr. Sura, as I discussed with you prior to this, so men's mental health is something that I'm, very, very keen to learn more about. And I think there is so much awareness that needs to be created around this topic. So I have put together some questions. To begin with, how do you and why do you think, we know like broadly an answer to this question, but why do men find it particularly difficult to address their mental health issues when it comes to it?
Yeah, so there's a prevalent belief, Jagdeep, that men don't access psychological therapies very well compared to their female counterparts, the women. IAPT is a Improving Access to Psychological Therapies program in the UK, and about 36 referrals. This is data that's a few years old, but they were men. So the vast majority of people taking up those psychological therapies at that level were female. Yeah, so almost like a 2/3 female, a third male, and we also know that suicide rates are higher for men, somewhere in the region of about 4 times. In some countries, 6 or 7 times more likely than women to commit suicide. And we also know, Jagjit, that from psychological research that whilst men underreport things like depression, they have higher rates of substance misuse. And of course, as I'm saying, high rates of suicidality. So something isn't adding up, right? So it's clearly the case that men, for some reason or another, are not coming to the attention of services, or they're not expressing their needs in a way that we can understand and people can respond to. So the question really as to why that might be, it's a big question. I think a lot lies within, there's two or three broad responses, I would say, to that question. First of all, the way that men might express distress is different, and some of our screening tools that GPs might use or primary care professionals might use, or even at early levels of, when they access psychological therapies, they're not particularly attuned to picking up how men might be presenting with difficulty. So if we take depression as an example, there's a whole list of symptoms that are quite what we call internalizing psychological symptoms, internalized distress. So there might be things like withdrawal, sadness, tearfulness, what we call anhedonia, crying for without any reason, loss of motivation, loss of interest in previously enjoyed activities. Low mood, of course, everyone attributes low mood to depression, but there's a whole host of other symptoms. Now, men might not display those sorts of symptoms, so their symptoms are almost masked, on the level of depression. Whereas men might present with more irritability, which is also one of the symptoms of depression. They might present with more anger, potentially aggressive tendencies. Obviously, I'm not saying that all men are aggressive, but those tendencies can be there. And also, as I've mentioned, substance misuse. So 4 times more likely to have a substance misuse problem. I mean, a serious alcohol or drug addiction than women. So those sorts of symptoms are sometimes taken as kind of antisocial behavior, or some kind of poor upbringing, or maybe a social class issue. So they're not necessarily defined within mental health. So that's the first reason that I think professionals sometimes miss and don't fully understand the way men may be presenting distress. The second reason is that I think men are socialized into being leaders and being self-reliant, problem solvers. So this is the kind of gender stereotypes that we come across. So the idea of needing to depend on somebody or ask for help or to present as anything less than invincible, strong, stoic, resilient, robust, being able to handle your affairs, being able to be a provider, anything that questions that kind of masculinity, if you like. And masculinity is many things. There's many types of masculinity. But that stereotypical masculinity I'm talking about, that if a man feels any of that is in doubt, it's a very vulnerable place to be. And vulnerability is something that very masculinity stereotype will run away from, right? So sharing those problems, discussing them, they would very often be hidden, or men may seek to distract themselves from those problems, or they may try to numb those sorts of feelings through either excessive work, that's one option, or as I say, through substances, alcohol often, or other things. So that's the second part. And the third one's kind of connected to the second, that masculinity stereotype that I'm talking about, that there is something about men and women, a difference, broadly within them. Again, we're talking in generalizations here, and men and women are very different, unique individuals. But as a group sort of effect, what the social sciences and psychological research has shown is that men tend to have smaller social networks than women, and also they're less frequently likely to discuss their social support needs within their friends or family group. So it's not that they don't talk, but they may not necessarily talk about these sorts of issues, personal struggles or stresses or strains. So for that reason, there isn't that sort of somebody to help in a crisis, or someone to guide you, to suggest, well, this happened to me, this is what I did, why don't you try talking here, which would be a more natural conversation within female groupings, and females will generally have those conversations in a more natural way. So because men don't have or haven't created that sort of network, or it's not seen as permissible to talk in that way, because you may be perceived as weak or not very strong, and so on, and that can be very stigmatizing and sometimes can invite rejection. So men don't do it. So I think those three broad reasons is what's getting in the way of why men aren't getting the help that they need.
Yes. Yeah. No, absolutely. And I think generally, again, can't really say everyone, but like as women, women tend to be more expressive generally too. So for example, I personally have suffered from anxiety, but I know that if I won't be able to talk to my husband, I'd have like a close knit group of friends that I might confide in, or family, for example. But however, men, they don't tend to do that because of the conditioning that we have in the society culturally as well, that you are the one who has to take care of everyone, so you don't literally talk about you not being able to cope with it. So yeah, totally understand. And yeah, thank you so much for that. For the next question, so what kind of signs do you think we can look for in men going through anxiety or depression? Like we discussed that because women are more, they can express, they're okay to express most of the times, but because men aren't doing that, what signs can we look for to make sure that they're okay, the men around us are okay, and how to go about it?
Yeah. So I've been working in mental health for 23, 24 years now. So I've seen probably, I couldn't count, but I must have seen thousands of men, women, couples, children, even teenagers. And I've come across many, many women within that interaction who also struggle with emotional literacy, aren't particularly good. Trust is another issue which I didn't mention in the previous question. So it's not, it's not unique to men, but by and large, there's this general sense that women, and I think it's true that in my experience, that women are more able to seek help, talk about their needs than men. And then there are those cultural impacts as well. So I do work with increasingly actually since lockdown, which is very interesting. I've seen a number of Punjabi men from India and also South India who have presented because their usual outlets have been narrowed. They've been in lockdown at home more, not able to go out, businesses are closed, work settings are shut. So they've presented with difficulties. And what I find, and I did quite a lot of research into cross-cultural expressions of distress and coping for my doctorate. And so when we talk about the Indian subcontinent, South Asian men, particularly I focused on in my research, they often exhibit their symptoms in a physical way. So one of the things to look for in the questions you were asking, that if a man is talking about lots of back pain, headaches, chest pains, and in fact, a lot of the men that I'm talking about that have come to me have come through that route. So anxiety, that they may be, on the verge of a heart attack or a stroke, or something is wrong with them physically. So because physical expressions of distress, and I think this is true for men across the board, but more so within South Asian communities, is this idea that a physical expression of distress is more acceptable because that can happen to anybody, right? That's not a weakness of character or lack of resilience. If you're ill, you're ill. A heart attack can happen to anybody, right? I mean, so Christian Eriksen collapse for the Denmark football team on a field, such a fit, strong, man with such ability, and yet he can have a heart attack. No one's going to stigmatize him for that, right? They'll just see it as. But when it comes to men, that physical expression of distress, and sometimes for women, South Asian women too. So Krauss was a European psychologist. She did some research back in, I think it was in the 70s or some time ago. And she talked about how Asian people, particularly women in that instance, I know we're talking about men's mental health, but they expressed depression as a sinking heart feeling, that I feel a heaviness in my heart, I feel a heaviness in my chest. Now, if you refer such a person, male or female, to a cardiologist, you probably want to get it medically checked, right? But actually, this is often a psychological expression of distress, right? So those physical symptoms. Second thing, as I say, if you find that men are overworking, they're working excessive hours, working into the night, bringing work home, staying longer at their place of business or work, that is often a sign that something is not right. The balance is out. And of course, if you notice that, you're in a family, it's your partner, it's your son, it's your brother, it's your neighbor, whoever it might be, and you're noticing that the level of alcohol intake particularly is going up, that's also a warning sign. Why is that happening? What is the necessity or need for excessive amounts of drinking? I was speaking with a young man who has had to leave university in their second year. And this individual is drinking, 10, 12, 13 pints of beer each day, as well as some Class A drugs and some recreational drug use as well. Now, that is not whatever we say in a libertarian society, if we have a sort of liberal point of view that people can make choices, what is it that drives an individual to behave in that way? I mean, how can you function? How can you be emotionally or cognitively or socially present with that amount of substance misuse? You can't, right? I was telling you, and obviously, most men won't be doing that amount of substance misuse. But if you notice, that it's trickling up, that it's more frequent, there's more of it when they do drink. That can be a telltale sign also. And then, of course, as I say, if you're noticing greater impatience, irritability, more annoyance, over things that wouldn't normally have upset somebody, it's often a sign of some sort of stress or strain in their lives. And stress, anxiety, depression, they're very synonymous. They're like cousins of each other. There's a lot of comorbidity, what we call. They coexist. So if somebody is stressed, they tend to become anxious. If they're anxious, they tend to become depressed. Because if you're feeling anxious a lot of the time, that is going to bring you down. And also, if you're feeling down, sometimes it goes the other way. A person becomes anxious as to why am I feeling this way all the time? But that's where it's likely to come out. More irritability, more impatience, annoyance, that sort of thing. And the last thing I would say is that if you find that the individual, whether it's a relative or a friend, is actually no longer doing the things they used to enjoy, they're not going to the gym, they're not meeting up with friends, that they're not playing sport, whatever it might be, that can also be a sign of behavioral change like that, that something doesn't feel quite right. Yeah. I mean, I was speaking to one lady, and sadly her husband committed suicide. Right. So he actually died. He died about a year ago, and I know this can be painful for people that may be watching this webcast. This program that you're putting out. But it's important to talk about these things. And apparently, this individual had actually been depressed for years. And the lady, his wife, found journals in which he'd expressed his sadness, his depression, what he was feeling, but he'd never spoken to her about it. Right? And when she kind of reviewed photographs, videos, birthdays of the children, and she could see, looking back with hindsight, that he was not really present. He was, his eyes were dazed. He didn't look, he wasn't smiling. He didn't seem to be engaged. And we sort of just take that as a personality trait. They're busy, or they've got too much on, or whatever. But consistently, she was able to see those things. And the day before this individual committed suicide, he'd spent 12 minutes on a suicide hotline talking to somebody. And yet when he came home that night, he didn't mention it or talk to his wife at all about it. So I think it's very important. It's a good question. We need to look out for those signs, be aware of them. And I think it's about our closeness and our level of emotional intimacy, even if a man finds that difficult, for others around him to try and provide that space, and create that space. And sometimes the best way we can do it, Jagdeep, if people are wondering, well, how do I do that? How do I create that? Well, the best way to create emotional intimacy is to do it yourself, because once you, intimacy can be a play on words, right? If we break it up, it kind of can mean in, to, me, see. So if you allow someone to look into you, so if you're a partner or a mother, you share some of your own life experiences, what you're going through, let the men in your life see the things that you're struggling with and talk to them about it. That tends to breed intimacy. So if we give it, whether it's a brother giving it to a brother, or a father giving it to a son, or a partner giving it to a husband, or whatever, When we give it, it invites the other person, positions them to do the same because you got onto that wavelength of conversation.
Mm.
When you've created intimacy, those conversations are more likely to happen in future. Yeah.
Absolutely. No, that makes so much sense. And I personally, like at work, had a similar situation, a very tragic event. And, when we all reflect back, and this person was the most strongest person in the room, fittest person in the room at any time. And someone who was always, up for a banter, jokes, and somebody who, anybody would be the last person to think that they would have gone something like that, so drastic, to then think that this was their last option. And that really made me think. And when we're reflecting and thinking back, we are saying, but yes, yes, that was true. But like, we didn't expect that. But also because of the conditioning we have in the society of the toxic masculinity, as we say, the person himself, they also thought that the society's expectation of me is not to, say that I am dealing with this and I can't cope with this right now. And we were saying, like, how could this person do this? They looked all happy and content in everything they were doing. So I think it goes both ways. So I think it's very, very important what you just talked about, looking out for those signs. And when you were discussing all of these, and I could already think about, some of those already made sense, like, only if we could have done something and, really looked out for. So yeah, I think that is really, really important. And creating an awareness about that is so important. Given the pandemic, like you said, people were, very, very limited in terms of, people are not going to work, working from home, and, your circle is very limited. You couldn't meet with people. I think that made it so much more relevant. And I hope that, going forward, we can always think about these things and be considerate and, think about people around us in that sense, in that context. So we've already talked about the signs to look at, and you also touched upon how to support men going through that, and basically by trying to create a channel wherein you can share some of your insights and how you're feeling, really open up, and that kind of makes the other person feel more comfortable, and then share how they're feeling as well. So I think we have touched upon that point a little bit. And what would be your advice to men going through mental health issues? And this is also about what we can do with people going through what they're going through, but also for if somebody was to watch this video, or if I was to share it with someone, what would be your advice to people, to men who are going through this, and what can be done to help them tackle the challenge that they feel that they have?
Sure. So the first thing is, the brain, through which a lot of our mental functions operate. It's an organ like any other in the body. It's a very sophisticated organ, very important organ. Everything channels through it, But there are sometimes, just as we can have imbalances in our hormonal system, or we can have, blocked arteries, or we can have other physical ailments, broken legs, and so on, the brain and our mental function can also suffer. Sometimes it's a response to stress and strain, so persistent, difficult experiences in life. For some, it might be an important loss or bereavement. For others, it might be a redundancy. Someone else, it might be a marriage breakup. For others, it might be bullying and harassment. It might be a long-term illness that you're diagnosed with. I mean, there are countless ways in which we can be impacted by events in life, And if we are struggling, it's actually a natural response to stress and strain. And I would say this particularly to people, Jagjit, who, have a particularly spiritual bent of mind. And again, I'm thinking about South Asian communities. This idea that any expression of distress is somehow communicating that you don't have a strong faith or belief. So if you're a person of faith, I think we really need to jettison these ideas. They're not helpful because our spirituality, I know we're going off track a little, but any spirituality that makes us less human, and humanity and humanness is about our strengths and our abilities and our creativity, of course, but it's also about our fallibilities, our fragilities, the things that we find difficult. Human life is everything, warts and all, the beauty and the ugliness. So if any person is struggling, first of all, accepts that this can happen. It's often a natural response. Secondly, just as we can get treatments for physical ailments, there are ways, remedies, and ways of working that can help with our mental, emotional distress. Okay, so there are ways that we can manage very negative, self-bullying, anxious, depressive thoughts. There are tried and tested approaches, that have a good evidence base. So if you're thinking very negatively, you have a lot of burden on your mind. You're anxious, either anticipating things that are going to happen that you're worried about, or you're living in a lot of regret and guilt or shame about something that happened in the past. All of these complications can be ironed out. There are ways, thought stopping, thought challenging, mindfulness, coming into a different way of, making our thinking more positive. And also our emotional distress. If we're feeling dysregulated, we're getting angry, we're irritable, we're feeling overwhelmed. There are also ways to regulate the way we feel. So there's a whole host of breathing and relaxation and stress management strategies that are very effective, and they don't necessarily require medication. In some cases, we should mention that too. There are antidepressants, anti-anxiolytics. They work on the serotonin systems primarily of the brain. These chemical imbalances that can happen. It's a contentious subject. Some people argue against it, but I've personally seen that in some cases where there's a chronicity, the mood has been down or the anxiety has been up for quite a while, what we call SSRI medications, they can be very effective. I've seen individuals who appear like different people. They really do, over a course of 6, 7, 8 weeks of being on medication, can really lift themselves and feel very much more positive. But alongside that, I would say GPs and the NHS, because they're struggling with mental health provision, that tends to become a first port of call, whereas it's only ever supposed to be the second port of call. You should never be on any kind of psychoactive medication without talking therapies. And if your GP is pushing you to take antidepressants and isn't making a referral for counselling or cognitive behaviour therapy or psychological therapy, you need to challenge that, because both things are needed. In fact, you should have the talking therapy first, okay, in many, many cases. So all I'm trying to say is that there are ways and means of improving the way we think and feel, and also our behaviours. So if we are drinking excessively, developing unhelpful habits, there are also ways in which we can change what we're doing. It's just about creating a safe space where you can have those conversations and make some new plans. And there has been some research, Ajit, in terms of how do we help them, because if they present with distress, emotional distress in a different way, sometimes the treatments need to be tailored a little bit differently to the talking therapies. So the first thing is, rather than the toxic masculinity you talked about, actually we can convert that, like many things in life, into a positive. So being self-reliant, wishing to be resilient, wanting to be a problem solver, rather than staying with emotions and feeling emotions and letting emotions out, which is often what people, they talk about it. People who are critical of talking therapies, they'll say, oh, it's all that sort of airy-fairy feeling stuff, right? But actually some of these attributes that men stereotypically have, they can also be channeled into therapy. So how do we create a healthy self-reliance? How do we create a resilience that isn't avoiding your problems, but is actually giving you the strength to face up to them? And a big one is this idea that we need to be providers, we need to be able to fix things, we need to be strong and there for our families, not weak or vulnerable. Well, actually, one of the most responsible things you can do if you're suffering with a mental health problem is to get some help for it, because your children will experience it if you have children. Your partner will experience it if you're married. Your family will be worried about you. So if you want to be responsible, you want to be a provider, which lots of men and women want, then actually addressing those emotional psychological needs is important. And actually, there was some research that men who have made a suicide attempt, but survived it, one of the factors that really reduces the likelihood of a repeat episode is their worry for the impact it will have on their children and on their families, right? So if we remember that actually if we're self-harming or suicidal, or we're driving and feel like men often describe it in this way. They feel like driving into a brick wall or driving off the motorway, crashing. Men tend to, when men commit suicide, they tend to be sadly much more aggressive ways in which the end of life comes. And I think always consider that if you're depressed or feeling in this way, actually your children and your family need you. And the funny thing is that whilst a lot of people talk about suicide as a selfish act, people that are feeling suicidal and are men often describe it as a very selfless act. Now, think about this, right? The way that they express it and have expressed it in literature and in clinical practice is that they feel that I'm so sort of unhappy and behaving in a way that I'm making life miserable for everybody. So they'll be better off without me, right? But actually, it's never the case. In most cases, the family wants to have a future with you, and they want that future to be bright and happy and full of good experiences, and that is possible. A preferred future can be created. Problems, when they come, if problems exist, solutions exist too. And if there are constraints that keep us down and weigh us down, then there are resources that we can mobilize that will lift us up as well. But sometimes we just need a little bit of support with that. And support is not a bad thing. Think about it, without a teacher supporting us, we don't learn. Without a football coach teaching us how to dribble and shoot, we don't improve. If we don't get some sort of apprenticeship at work or some sort of mentorship, we're not good at what we do. So in every field, in every sphere of life, we access support when we need it. It shouldn't be any different for our emotional health, our psychological health. So I would just encourage any men listening, pick up the phone, look at the internet. There are a lot of helplines, lots of national charities. The Samaritans is one that everybody knows about. If ever you're feeling down, they will talk to you 24/7. There's volunteers there, they're trained. At any point that you're feeling not yourself or feeling under pressure, feeling overwhelmed, even if you're not feeling suicidal, you don't have to ring Samaritans if you're suicidal. Ring them and they will talk to you in a supportive way. And that might be the beginning of them then signposting you to someone who could help you in a more regular way. Using those sort of helplines is sometimes a bit of a crisis response. It's important. But then we need to come back to how are we going to avoid getting into those crises in the first place. And there's a whole host of, in the NHS and in the private sector, counsellors, CBT therapists, psychotherapists, clinical psychologists, who are willing and ready to help. So don't be shy. Don't feel it's a weakness. It's a great strength. In fact, it takes great courage to face up to our problems and our difficulties. And when we can own up to it, we're a better man, I think. That's what I say when I say manning up. When people say man up doesn't mean, come on, shake off your problems, don't be depressed, be happy. Manning up means, if I've got a problem, I'm going to stand up and face it. I'm going to try and deal with it. And that's one of the most courageous things we can do. people that come to psychological therapy, they really aren't weak in my experience. You know, I think there's a weakness when we avoid it. When you hide away from something, you distract yourself from it. That's actually the weakness, isn't it?
Mm.
If we turn it on its head, when we face up to things, actually it's a sign of great strength because it takes courage. It's an unknown, it's uncertain, we don't know how it's going to work, but it does work, and there are lots of evidence-based approaches. So do it, give it a try. That's what I would say. Yeah.
Yeah, no, you're right. It's such a courageous thing to actually, to be dealing with something and then deciding that, no, I'm gonna, do something about this and I'm gonna actually bounce back for myself or my family. And that's really what it is about, like you said, manning up. So thank you so much, for all this, these insightful views and all the knowledge that you shared. I am very, very sure it'll be very useful for so many people. And one thing I wanted to talk, just kind of re-emphasize on that you said, like, you're right when you say that you go to GPs and what first thing you are given is like, you're given a prescription medication. That's usually what I have seen and what usually seems to happen. But the fact that you could question and ask for therapy, and I think that is really, really useful. So that's something I think everybody should really, try to have that going even in parallel, if that's what it means. But I personally think that's something we can change, if people are going through that. So yes, thank you so much, Dr. Sura. It's been such a pleasure, and I am so thankful, for the time that you've given today, as well as the insights that you've shared. I'm very, very, very positive that a lot of people are going to learn, and this is going to provide so much value to so many people. Thank you again.
Thank you very much, and I'm honoured, privileged to have been on. Thanks for arranging it, and I wish you well with all of the good work you're doing.
Thank you so much. Thanks a lot. Take care then. Bye-bye.
Bye.